Hi, anyone sure? Is it on now? Oh, I think I'm in right now. Hi, I'm Evan, a clinical audiologist from China TV Hearings, and I will be the host for today's Facebook Live. Oh, nervous? Okay, this is my first time ever on Facebook Live, and I hope everything will go smoothly and everyone here can enjoy it and learn something new from today's sharing. As we all know, there's an increasing number of people with hearing loss, with suffering from hearing loss and affected by hearing loss nowadays, not only elderly, but also young adults and also children. So today we take these opportunities to talk about what is hearing loss and what is the effect of untreated hearing loss. And we are very grateful to able to invite an ENT specialist from Hospital Kuala Lumpur, Dr. Hazim here to be with us. Give me a few seconds to add Dr. Hazim into the stream and say hi to everyone. Hi, Dr. Hazim.
Hi, good afternoon.
Thank you
Yes,
for your time to being here with us.
yes, it's my pleasure also to be.
Shall
Hmm.
sorry?
Yeah, it's a pleasure also. Thank you for inviting me.
Yeah,
Thank you for inviting me
okay.
here. Okay,
Hope today's sharing is very fruitful from you and
okay,
we can learn a lot from you.
sure.
So, shall Dr. Hazim introduce herself a bit more so the audience can know more about you?
Okay, hi, Assalamualaikum and a very good afternoon. I am Dr. Muhammad Hazim bin Abdul Ghaffar. I am an ENT specialist, currently working in the ENT department, Hospital Kuala Lumpur. Okay.
Okay, thank you again, Dr. Hazim. Yeah,
Hmm.
so today, Dr. Hazim, ENT specialist from Hospital Kuala Lumpur, and me, even clinical audiologist, we will share about what is hearing loss and what is the signs and symptoms, what is the effect of hearing loss, and how should we prevent ourselves from hearing loss. If any one of you have any questions or any concerns, feel free to drop a message in the comment box below, and we will try our best to answer most of the questions throughout the sessions or at the end of the session. Okay, Dr. Hazim, I'm
Yep.
pretty sure that there are some patients that came to you and asking that, Doctor, I have difficulty in hearing in certain situations like
Hmm.
noisy environments, like noisy cafe, noisy restaurants, right? Do you
Yep.
encounter any of them?
Okay. Okay. Thank you, Evan, for the question. Okay. First and foremost, I would like to thank 20dB for organizing this event and also inviting me to share my thoughts and knowledge regarding a topic which is very important and very close to my heart, which is hearing loss. And also thank you to the audience and the public for joining us for to have this fruitful discussion today. Regarding your question, even of my patients having hearing loss, actually, there's a lot in my day-to-day practice. There is a lot of my patient that is suffering from hearing loss. Hearing loss, actually, dear audience, is becoming a common worldwide problem, affecting all age groups and leading to a marked disability and also handicap. According to WHO, the World Health Organization, in 2012 alone, it is estimated that about 360 million people worldwide suffer from hearing loss, which is roughly about 5.3% of the world's populations. And out of this, 91% of them are adult and 99% of them are children. Okay, and also the prevalence or the incidence of them increase with age. For example, for in the children, the prevalence is about 1.7%, it increased to 7% in those who are 15 years above. However, it is estimated that about 1 in 3 individual over the age of 65 suffer from hearing loss. So there's a lot of my patient, especially those who are in their elderly, suffer from hearing loss. But what is most alarming to me that in it is not common. It is common knowledge that in our society we have exposed to noise pollution. We are increasing using. We are exposed to loud noise, or either we are working in an environment that is constantly exposed to loud noise. So I'm seeing more and more people that is in their mid 30s to 40s that is suffering from hearing loss, which is not, which is a very alarming and scenario to me. Okay, and what's more, even in because of this problem of hearing loss and the increasing incidence of hearing loss in our population, WHO has listed it as 20 leading causes of burden of disease. Okay, and WHO has also listed hearing loss as the most common cause of disability globally, even more than other causes of this disability. All right. So it is becoming more and more common in my practice to see patient with hearing loss. Okay. How about you, Even? Do you encounter a lot of patient in your as an audiologist? Do you have how usually what kind of patient and how old are them who come to see you, Even?
Wow, yeah, we can see there is an increasing trend, the numbers of patients that came to us for hearing tests, for hearing aid service, and
Mm.
how a lot of age range, but mostly I can say it's elderly, but not only elderly, we also have adults, young adults, and even children. So we did a lot of hearing service as well.
Yeah. Okay. All right. Usually, how do they come to you? Usually, do you come to you? Uh,
Uh,
mm.
some they do refer from hospital, and then some they look from us from our Google, our websites, Facebook. As right now is a trend, right? All internet. Yeah, and
I
some
see.
or by their friends, family. Yeah, some is referral from ENT doctor
I
or
see. I see.
especially by speech language pathologist. Yeah, there is lots. Yeah.
Yeah. Okay. So, coming back to the question, just coming back to the discussion just now. Okay, like what you say, even. Of course, in my practice, there are patients that realize that they are having or experiencing hearing loss. Okay, but the challenges comes when some patients does not realize that they are actually experiencing hearing loss. Sometimes they come with vague complaints, and we as a doctor and a clinician have to sort out what is the problems. Okay, and also some of, especially those who are elderly, who are taken care by a caretaker, either their children or in nursing home.
Mm,
Uh, one of the message that I want to relay to the public that not necessarily the patient will complain directly that they have hearing loss. These are among other complaints that I frequently encountered in my practice. Number one, sometimes they will say that I frequently ask people to repeat what they have said. They didn't complain to me directly that they have hearing loss, but these are among the common complaint that I have encountered in those suffering from hearing loss. Number two, sometimes they will say that I can hear people speaking, but have difficulty understanding what they are saying. These are also a sign of hearing loss. Or other, sometimes those who are elderly or staying with their family will say that my friend and family complain that I have the TV already turned up too high, or I struggle to hear in noisy places. Although all of this complaint is not directly, they don't directly say that, oh, I have hearing loss. But actually, if you or all the any of the audience listening to this having similar problem, most likely you have hearing loss. How about you, even do they in your practice, do they directly complain to you that they have hearing loss? How do, in your experience, any interesting patient or scenario that you can share with us?
There is two scenario. One is they came in themselves and they complained on their listening difficulties, like they couldn't hear while listening to phones. They couldn't hear while when in noisy situations. And
Mm,
another scenario is the patient itself doesn't aware of he or she have hearing problems, but the family members bring him or her to
yeah,
here to us and say, I found my dad couldn't hear well. Uh, Recently, I asked something, but he answered in different things, or
true,
he
true.
watched TV in a very loud volume. Even
Yeah,
the next door neighbor also will complain that why your
yeah,
TV open until that loud. Yeah, so that this is two kinds of scenario actually. Yeah, but
yeah,
all doctor have mentioned earlier, that is the most common things that I have listened to. I have get report from
yeah.
my patients. Yeah.
Okay, because also, so the message is clear that some of them, they don't realize that they are suffering from hearing loss, and also so it's up to those who are living. For example, the case that you mentioned just now, the children, either son or daughter, realize that their parents is talking loudly, cannot hear well, or use increasing the volume of the TV very high. All of these are are symptoms of hearing loss, which maybe the patient doesn't realize. So you, as a caretaker, should realize, pick it up, and maybe bring it, get them tested and treated. Okay.
Yeah. Yeah.
Hmm. Okay, coming back to the discussion. Okay, we are talking about hearing loss. I've mentioned about the statistic and how it's increasing in trend. Okay, now let's discuss a bit about the types of hearing loss. Okay, this is a picture. This is a cross sectional of our ear. Okay, from outside. I don't have a pointers here. I'm terribly sorry. So from outside, they on the left side of the screen, that's the outer ear. It comprises of our earlobe, our ear canal, and that's our ear membrane. Those are a component of the outer ear. And from the ear membrane towards inside is the middle ear. It's like a six-sided box, which contain our ear bones, the ossicles, and the inner part is the inner ear, which relay the it changes from the sound energy to the electrical energy and goes to the brain, and the brain interprets it. So there is actually three types of hearing loss. Number one is conductive hearing loss. Okay, what do they mean by conductive? Meaning that the sound that is being produced, let's say I'm saying that hello, coming from my mouth, goes to another person's ear, so it will be transmitted towards the ear membrane. Toward the ear membrane, towards the middle ear, where inside the inner ear, it will change into the electrical energy. So if there is any problem that is preventing the conduction of sound towards the inner ear, it is considered as conductive hearing loss. Number two, the second type of hearing loss is sensory neural hearing loss. There's no problem with the conduction of sound. Sound can travel easily from outside towards the middle ear, towards the inner ear. But the problem lies for the for it to there's a maybe there's an injury to the inner ear, so it cannot relay the information to the brain to be interpreted. And the last but not least is the mixed type of hearing loss, which is a combination of both conductive and also sensory neural. Hmm. Okay.
Yes.
Okay. Now I would like to talk a bit about causes of hearing loss. Okay. Maybe a lot of I'm not sure, maybe yeah, in your practice even, but sometimes maybe a lot of our public thought that the causes of hearing loss is mostly attributed to impacted earwax. But actually, that's not the only cause. Actually, okay. Just now I mentioned that the causes of hearing loss can be divided into conductive, sensorineural, and also mixed. And let's focus on the right side of the monitor of the screen. You see the number top is aging process. okay, or aging, because as we age, the hair cells get degenerated and cause hearing loss. Okay, and it is globally becoming one of the most common cause of hearing loss. Okay, but number two, what is more alarming, as I mentioned just now, the incidence of hearing loss among the younger age group, okay, among the age group, even as young as 20 years old, becoming develop hearing loss because of frequent exposure to loud noise. Okay, this is what we call noise-induced hearing loss, NIHL. Okay, in my to share my experience, I have diagnosed one patient. He is a he is a software engineer. Yeah, no, I think he's an engineer. Not sure whether he's software or mechanical. He deals with the machine, even. So he deals with machine with the service of the machine. He requires to service to make sure that the machine is functioning well. So he's been working at the firm for many years without using a proper ear protection. And one day he realized that he is becoming increasingly cannot hear what is being spoken by the spouse, cannot communicate with his superior, he cannot communicate with his colleague well. And when he is at that time is only 30 years old, if I'm not mistaken, 31 or 32, very very young. And when I examine him, I do a hearing assessment, he already experienced or moderate to severe hearing loss. It's very sad for me, because he's very young. Number two, pertaining to noise-induced hearing loss, I've also diagnosed a military officer. He's a military officer, which requires to do a frequent uh, gunshot training. Okay, actually, by right, all of these high-risk job, which is exposed frequently to loud noise, they are required to wear hearing protection. Okay, either is and the their company or their supervisors should provide with a proper hearing aid. So this military officer, when he come to me, or also again, and I tested already, developed severe hearing loss, which require intervention by using hearing aid. Okay. Other cause that is common, ototoxicity, auto referring to ear, is toxic. So there are certain medication that can contribute to hearing loss. For example, um, for tumor drugs, there's a common tumor drugs. There are also certain antihypertensive drug that can contribute to hearing loss. Other than that, diabetic medication and not diabetic, tuberculosis, malaria. There are certain medications that are known to cause hearing loss as its side effects. Other causes, although rare, but I still in my practice see is tumor. Okay, tumor, cancer. Okay, the cancer can either occur at the ear region, what we call temporal bone carcinoma. Okay, carcinoma, or glomus, a benign tumor, glomus jugulare, or it also can occur higher up at the brain level, what we call cerebellopontine angle tumor. It's not that common in my practice to see this kind of patient who have tumor of the ear or the brain to develop hearing loss, but although rare, I've still seen it because it's in my practice. Okay, and on the left side of the monitor is the conductive causes. Okay, yes, I agree with you. Impacted earwax, also common patient. From time to time we see patient who regularly perform ear digging, so they will push the earwax even deeper and they will develop impacted earwax, which contribute to hearing loss. Okay, and in children, they frequently put foreign objects in the ear, either toys or bead. They may also develop conductive hearing loss, or in certain patients there are retention of fluid within the middle ear. So you imagine as if you are hearing inside of as if you are diving in a swimming pool, whereby the conduction of sound through the fluid will not be effective. So all of these contribute to conductive hearing loss. And in the middle is a mixed component. There are known diseases that can contribute to hearing loss, especially infection, either infection of the outer ear, what we call otitis externa, or infection of the middle ear, what we call otitis media, whereby there will be a lot of inflammation, pus formation leading to hearing loss. Or there are also causes of injury to trauma. Patient involved in motor vehicle accident, injure the temporal bone, or get beaten by maybe assaulted, so they injure their ear or their temporal bone. All of this may contribute to hearing loss. So actually there is a lot of cause of hearing loss. Most common, as I mentioned, aging. There's not much that we can do about aging, but what I'm trying to say that other than that, the other cause is treatable, or better yet, is preventable.
Yes. Yeah. Yeah, from what Dr. Hazim has shared, there's a lot of causes of hearing loss actually. It's not only impacted earwax, which most of people thought about.
Yeah.
Because I have patients that came to me and say, even my hearing is worsening recently and I couldn't hear well. Is it because of my earwax is blocking my ear? Shall I remove my earwax so my hearing will back to normal? But actually, it's not really. Even if you have a very clean ear canal with very minimal earwax, your hearing loss maybe is due to another factors also, like there's ear infections or there is noise exposure, or maybe because of aging, as Dr. Hazim has mentioned earlier. So it is very important for you to look for professionals like Dr. Hazim and ENT
Yeah.
specialists or audiologists for ear check, and shouldn't let the problems keep there for a very long time, as it might impact yourself or your lifestyles, right, Dr. Hatim?
True. Because hearing loss is a symptom. So it is up to a professional, medical health professional, ENT special audiologist, to determine what is the cause. And when we have determined the cause, we can treat the condition effectively. Uh,
Mm.
so, okay, we move on. Okay. Just now I have mentioned about hearing loss, the type of hearing loss, but now we come to the main topic of the day, main question of the day. How does hearing loss affect your life? Okay, well, what I'm trying to emphasize is, even though hearing loss is a physical disability, it does have a huge impact not only on the physical part, also psychologically, functionally, and also it poses a burden to the economy. Okay, number one, like, it has a significant impact on the person function. Obviously, patient have communication difficulty. They, when they cannot hear well, they also cannot interpret what the other counterpart is saying, and they cannot convey their message well. They cannot communicate well with the other counterpart. Okay.
Yeah.
uh,
Sorry,
hmm,
Dr. Hatim.
yeah.
Sorry, your slide is half of your slide. I couldn't see your full screen slide actually.
Okay, all right, sure.
I'm very sorry about that. Yeah.
Okay, I try to do it.
Okay.
Is it okay?
Still is
It's still hard.
halfway. Yeah. Or maybe we put it.
Oh, yeah, I yeah, try to adjust it. Is it still also still?
It's good right now. Thank you.
Huh? Is it okay?
Yeah, it's okay right now.
All right. Coming back to communication difficulties. So, but well, I think it's a no-brainer. Everyone knows if you cannot hear well, you cannot communicate well. So, like I mentioned just now, patient, they cannot hear when the person is talking to them, especially those who have been moderate to severe. almost they cannot hear almost anything, or sometimes like as we know, they can hear a few words, for example, but the high frequency, they are lost. So one whole sentence, they are like a patchy of words that they cannot hear. So they cannot hear well. They don't understand well instruction. So this will pose a lot of distress, or that's anger,
Sure.
frustration to them. Okay, all right. Number two, it also hearing loss will affects a person work performance. Like the case that I mentioned just now, the software engineer that he is actually a mid-level manager, but he still have to come to the site to supervise his all those supervised people that are working under him. So when he cannot hear well, he cannot hear what his superior, his boss is talking to him, and he also cannot hear what is the his juniors are talking to him. He also cannot. He also need to, in order to communicate, he have to increase his voice louder. So eventually it will reduce his work performance. I also encountered even a teacher, a school teacher, who is a school teacher, I think a high school teacher, also have similar problem. So this patient is very distressed, come to me very stressful, very frustrated, because he cannot hear what is his school, what is his pupil, his students are talking to him. He cannot hear. So even when he go to meeting, he cannot hear what the headmaster is talking. So eventually it will lead to reduce in work performance. And for example, in this picture, you see, if you are a pilot, obviously you need to have a perfect hearing, or not it will cause a lot of mortality to your passengers. So those who have hearing loss, they have limited access to all of these occupation, which require good hearing. Okay, either telephone operator, or even a CEO of a company. Of course, the person need to have a good hearing in order to conduct meeting, meet with clients. So those who have hearing loss will have a reduce in work performance. And it is proven by a lot of study that those who have hearing loss are more exhausted after work compared to other employee. They have tendency to have sick leave, and they also have a increased risk of early retirement compared to other employee who have normal hearing. Okay, and as I mentioned just now, hearing loss will eventually it have an impact on the person's psychology, the emotional and mental health status. They become embarrassed because why? They are most of the time, the audience, if you know, some of the patient, they are those who have hearing loss, they tend to talk louder. Why? Because they cannot hear their own voice. So they tend to increase their volume of, they will speak in louder word. So they eventually, when another person maybe they realize that they are talking in a loud voice, they become embarrassed. So what will happen? They will be insecure. They try to avoid social gathering, and eventually, and some of them become angry, become frustrated, especially those who are maybe in the elderly living with their children. Okay, they are become frustrated because their children cannot hear what they are talking. So they have to talk loudly. Eventually, they become lonely, become isolated, they become depressed, they become sad. Okay, have you encountered certain in your even your patient usually, do they share this kind of effect to their life for hearing loss?
Yeah, actually, there's a lot of patients that have these kinds of cases. If I need to share, I think I need 2 days, 1 night then. So, but
I see, I see.
I do have patients that came in here and frustrated to talk with their spouse and their children
I see.
because they couldn't feel well while they are communicating. So gradually he keep himself away from his social circles, not longer going out with their spouse and children, and
Yeah.
not doing lepak with friends
Yeah.
anymore.
Okay. Yeah.
Cause them
Uh,
very yeah, it's because of the hearing loss. Yeah.
yeah. I've met one couple, husband and wife. The wife is having hearing loss, but the one who was came in and do most of the talking is the husband. Uh, apparently, both of them are frustrated because they cannot communicate well. But the husband, I can see that the husband is ventilating more of his frustration and anger because he most of the time he need to shout in order for the wife to interpret what he's talking. So it's very distressful and a significant impact to the patient. Okay.
Yeah.
Apart from the all the emotional impact I've mentioned just now, okay, surprisingly, hearing loss in the long term also have a strong link with dementia. Dementia, as you maybe for the audience, is forgetfulness. Okay, it's a one spectrum of forgetfulness. So those who are hearing loss is have a strong. They make a study and have proven that people with hearing loss have higher risk to develop early forgetfulness. They become early forgetfulness. Okay. Yeah, it's not only about the hearing, but it is also affecting the memory part of the patient. Okay, and as I mentioned just now, okay, overseas they make study on how hearing loss, because most of the time those who are going to communicate with the patient will be the spouse, and so people make study to see how does hearing loss affect the other half, the significant half of the patient. And true enough, it is proven that in a 5 years time, uh, the partner of a person who have a hearing loss have poorer mental health and well-being 5 years later. So it also affect a person relationship. Okay, and yeah, and eventually it will lead to it will lower the person quality of life than those with the normal hearing. Mm, okay.
Yeah.
Okay, all right. And just now I mentioned that how hearing loss will have a significant economic burden to the country. Well, surprising enough, WHO, the World Health Organization, has estimated that in an unaddressed hearing loss, it poses an annual global cost of 750 billion US dollar, a staggering amount. Okay, why is so? Number one, because it affects the health sector due to the cost to deliver the healthcare to the hearing aid. Number two is to educate the cost to educate the public. Number three, because it affects a person productivity and also the social cost. All of this will have a significant impact to the economy. So actually hearing loss, like I have mentioned just now, although it's a physical disability, it also affect the person function, it affect the person quality of life, it affect the person mental health, the person psychologically, and to a country it affect the person, it have a significant impact of the economy. That's why WHO has categorized hearing loss as the most burden disability
Yeah.
in the current modern era. Mm, okay.
Okay. Yeah. Sorry, doctor. Could you adjust a little bit on your camera so that we can see your face?
Okay. Sorry. I'm sorry. Okay.
It's
Is it
okay.
okay? All right. Okay. Is it okay?
Your
Okay.
camera for
Okay.
your yeah.
Okay. Okay. All right. Sorry.
I still can't see.
Sorry. Sorry. Okay. Because the camera is on the side. Okay. Wait,
Oh, okay, I understand. Yeah, now will be great. Yeah. Yeah,
Okay.
okay, thank you. So now we can see how hearing loss, untreated hearing loss affect
Mm,
your daily communications, your psychology, your mental.
yeah.
There's a lot like huge issues, right? So
Yeah.
any suggestion from Dr. Hazim that we could do to prevent ourselves from getting hearing loss?
Okay. So, well, so what now? Basically, okay. I've mentioned how bad is this hearing loss, how it's affecting people's life. Okay. So what now? Okay. My message to the public: number one, protect your ear. Okay. Like I mentioned before, there's a lot of cause of hearing loss. Okay. But the beauty of it, half of all cases of hearing loss, according to WHO, can be avoided through primary prevention. This is a data statistic done by the research done by WHO. Okay, okay. Let me share a bit of simple strategies that we can use to prevent hearing loss. Number one, the reduce of you. We must reduce the exposure, either due to occupational and recreational to loud sound. Okay, like I mentioned before. So in the world of frequently exposed to noise toxicity, we must more and more reason for us to protect our ear. Okay, like the case that I've mentioned before, either you are if you are working in a environment that is frequently exposed to loud noise, either you are a military officer, either you are working in a construction site, or either you are like I mentioned a software engineer that is exposed to loud machinery. Please, or even at the airport, those who are you at the as a ground handler, please wear insist wear ear protection. If your supervisor or your company doesn't provide it, know it that there is an act by the government mandating the company to provide their worker for ear protection. Okay, though that's the occupational part. And for the recreational part, nowadays youngsters, not even youngsters, even in the adult, we are more and more people are using hearing their earphone, okay, and hearing to music with a loud noise. Okay, so exposure to loud noise for a long period of time, what will occur? Your hair cell in the ear, the inner ear, will eventually become damaged, and in for the if you are for a short time, there will be you can recover, but a long term exposure will eventually patient will have a permanent hearing loss. Okay, okay. Okay, some people ask me in my practice, how loud is loud, doctor? So how loud is loud, or how should we protect our ear? Okay, let's talk about the sound intensity in something that we can measure. Okay, we measure our sound intensity in dB, decibel sound pressure level. Okay, if you now we are talking, our voice is about normal conversation is about can go 40 to 60. Okay, 40 to 60. If a person is yelling, it can go up to 90 decibel. Okay, uh, our jackhammer machinery is about 110 decibel SPL sound pressure level. Aeroplanes jet can go up to 120 130 dB SPL. So what's the rule of thumb here? The rule of thumb stated that if we are exposed to a 85 decibel sound pressure level, we can be exposed up to 8 hours before we develop uh, hearing loss. Okay, so the rule of thumb stated that an increase of 5 decibel, the exposure time become reduced before you develop hearing loss. So 85 you increase by 90 decibel SPL, the you are on just now 8 hours, you have reduced by half, about 4 hours. You can only be exposed by 4 hours before you develop hearing loss. You increase another 5 decibel, 95 decibel, from 4 hours reduce become 2 hours. Loud noise of 100 decibel, it only took 1 hour for you to develop hearing loss. So how to prevent it? Please, first of all, we must avoid to expose our ear to loud noise, either listening to loud noise, to music, loud music, or if it's part of our job, make sure that we are properly protected. Go to the construction site, to the operation site, using a ear protection. That's number one. Number two, follow healthy ear care practices. Okay, what I always see patient, okay, and it's common in our society. The we A lot of my patient always perform ear digging using either cotton bud or something, because it is common in our society. But let me tell you, dear audience, that this practice of ear digging is not healthy. Okay, you may remove a bit of the earwax, but there's another half of the earwax is getting pushed further inside, and as it goes further inside the ear, it will get impacted. It will, some of them be too deep until the middle ear, and that's where you feel blocked, you cannot hear. So it is not a healthy ear care practices. Okay, what I'm trying to tell that, as physiology, as normal, the ear by nature, the ear wax the ear is being designed. It can expulse the earwax by itself, by nature. Okay, all right. And another one, just now I mentioned about there are certain medication that can cause hearing loss, like cancer medication, TB medication, malaria, even certain high blood pressure can also cause hearing loss as one of its side effects. I'm not saying that you shouldn't take the medication. I'm saying that if the medication is required, we must you as a public must discuss with the physician, a qualified physician, before embarking on starting it. If the benefit outweigh the risk, then please, by all means, please go. But don't simply start any medication, over the counter medication, because all of this will eventually cause a significant impact on a person's hearing. All right.
Yeah.
How about
Yeah.
for ear protection? Is for you, even, do you provide it in your practice?
Yeah, we 20 dB we do provide the ear protection which is called earplugs, with
Mm.
more common names. Yeah, which is ready-made or even custom-made also to protect the ears. Also, we do provide it in 20
Oh,
dB. And a very important things from Dr. Hazim, it's very common culture here to use earbuds for cleaning earwax, right? But
yeah,
actually, you need
sure,
to be very, very careful on that because you would harm your ear without you knowing that. Because I have quite a lot of cases, they use cotton bud and cause the earwax accumulate at the back of the ear.
true,
Yeah,
true,
and
true.
needs a special clearance, or you need to go for a professionals like ENT to clear the
True.
earwax already. Yeah.
True. Okay. Yeah, I'm just a bit of the earplug just now. Your client that purchased this ear plug for ear protection. Usually, what occupation they are dealing with? Are they yeah, I'm just curious of what are their occupation which require them to use the earplug.
I have few, some is DJ in
Oh,
clubs
okay, good,
and
good,
some
good.
factory workers like in some factories we involve of loud noise, and
Mm,
some is engineer, and those some I have is because of they purchase of earbuds is because of their spouse is snoring very loud during
I
night time.
see, I see, I see.
They
Okay,
wear earbuds to reduce the snoring noise so that they can sleep well also.
okay,
Yeah.
I see. And usually, how do they get to know that the availability of their earplug? How do they know it? Is it through internet, or a friend tell them regarding the earplug? Usually, how they know about it?
Most of them they found it in internet, in through
Mm,
our website, or they some cases is we have done this and then their colleagues, so that they recommend to their colleagues that oh KTV do have the earplug, so
yeah.
that they come in us to find us and saying that oh they have friends before doing here, even like a lot of referral cases.
Yeah, so I'm in the cases that you have shared, I'm very happy that actually, like the engineers, those are working at a loud factory, they have they know the availability, the importance to protect the ear, and they seek help to prevent it. So I hope that by having this talk in the this evening, we can educate the public regarding the importance to protect the ear from loud sound. Okay,
Yeah,
and
much.
now, yeah, true, true. Okay, and just now I'm talking about prevention. Okay, but there are certain conditions. Just now I mentioned whereby a person already have a hearing loss. Okay, either they are too late or for whatever reason, for maybe they have a frequent infection, develop hearing loss, or they are on medication, which one of the side effect is hearing loss. So what do they do? Okay, okay. So to the audience, if you are suffering from hearing loss, or if you suspect your spouse, your mother, your parents, your sibling, or anyone around you that is having sign and symptom of hearing loss, please have your ear tested and treated. Because in this modern world, hearing loss, although it's a disability, we with the remarkable, with the miraculous miracle of science and technology, there's a lot of way how we can rehabilitate a person with hearing loss. Okay, in this picture, we can see on the left side of the screen, I assume it's an audiologist. This is one of the tests available for hearing loss, what we call a pure tone audiogram. Okay, where the person inside of the screen is being tested, whereby the person outside is the audiologist. Okay, what we do from here, they will introduce a few sound where and we assess whether the person inside, the patient, can hear it or not. So we will know the type of hearing loss. We will know the severity of the hearing loss. How about 20 dB? Even do you, how is it similar setting with you guys?
Yeah, uh, so far it's the same. So the audiologist will firstly will check the patient's ear conditions first. Is there
Mm,
any infected earwax that needs any clearance or not? And also then we'll do a hearing test to see their hearing levels. And from then, audiologists will consult or advise on hearing aid if necessary. Depends on
mm,
their hearing levels and their uh, current lifestyles and their listening needs actually.
I see, I
So,
see.
so Dr. Hazim ever seen
Mm.
a hearing aid before, or any patient came to you for hearing aids?
Usually they don't come with me directly for hearing aid. Most of my patients come with some form of hearing loss, like I mentioned just now. So we will work them up, and it depends on what is the cause of the is what is the cause of hearing loss, and we will treat it accordingly. It's a huge topic which requires another discussion. Safely to say, it depends on the cause. If infection, we will treat the infection. Okay, if it's due to middle ear effusion, that there's a fluid inside the ear, we will we will perform a simple operation to drain out all the fluids. But there are, like I mentioned just now, due to aging, due to noise, they already have a develop permanent threshold shift of noise induced hearing loss, so it's irreversible. So we will ask them to, one of the treatment option is using hearing aid. So in this picture, we can see it's modern, it's very sleek, very stylish, small. It's not as huge as like 10, 15 years before, whereby they have to use wires, everything. So, and a lot of them feel comfortable using. How about you guys? What are among the concern of people to use hearing aid, do you think?
I think the main concerns of the user is the cosmetic concerns. It's
I
like, oh,
see.
I don't want a big one. I don't want to be visible. I don't want other people know I have hearing loss. Yeah. So
Mm,
actually, they have some stigma on hearing aids. Actually, they still think that's very big, that's very bulky, that's very
mm,
visible. But actually,
yeah,
as Dr. In the picture, it shows that it's very small uh, over the years because of the improving technologies. And right now, even they come out with a very special features, which is Bluetooth features. You
Mm.
can pair with your phones, yeah, iPhones or Android phones also. You can pair for phone call streamings and videos and also musics also. So they can
I
enjoy
see.
more, yeah, enjoy more on
You
using
have
phone call.
like a Bluetooth, what Bluetooth or something?
Yeah, the
It,
hearing aids is acts like a Bluetooth device.
I see. Very modern, nowadays.
Yeah, it will be
Mm,
directly to your phone, to your hearing aids without using
mm,
any earphone or anything. Yeah, so it's very it's very advancing technologies nowadays actually. So our patient, because I have a lot of patients that complain they couldn't hear well on
mm,
phones actually. And then so with the current technology, it helps them a lot in answering phone calls actually, and especially for
mm.
those that are still in very active lifestyles, like still doing
True.
business,
Yeah,
still
true,
seeing
true.
people on phones.
Mm,
Like yeah, its phone is very important right now. Yeah, because
true.
I believe that most of the people nowadays spend most of their times on their phones, right?
Mm,
Yeah.
true, true.
Additional and additional to that, actually hearing aids is come with rechargeable functions as well. Yeah, as
Mm,
we all know, we have problems of handling small batteries with their shaking hands. Yeah, so right now with rechargeable, they just
mm,
put it in the charger and leave it for charging for overnight or few couple hours, then they can use for long periods of time, maybe a whole days actually. Yeah,
mm.
we should change our minds regarding to on hearing aids
True,
actually.
true, true.
Yeah,
Yeah.
but hearing aid is not the only treatments for hearing loss, right, doctor?
True, true. Well, we are talking mostly for adult. Okay. Hearing loss for this afternoon mostly. I'm talking mostly the impact of hearing loss in adults. So, but actually, one another spectrum of the hearing loss is in pediatric age group. Of course, one of the options for pediatric age group, we can use machine, what we call cochlear implants. We have other bone anchored hearing aids. Those are among one of the option. And also, actually, I'm talking actually in the local setting. Okay, cochlear implant mostly is done in the children pediatric age group. But I've read research in the overseas trend. Even cochlear implant, if the patient can afford it, it is performed in also in adults. So this is among other option available for hearing loss, cochlear implant, and also cochlear bone anchored hearing aid. We have cross. Okay, depending on the type of the hearing loss and also the severity of the hearing loss. There's a lot of option of rehabilitation. Mm.
Yeah, also yeah. Okay, yeah, I also have one patient that is a elderly. It's not elderly. It's an adult, which is
Mm.
about 50 years old plus, and she
Mm.
is using cochlear implants as well. Yeah, as
Okay.
sure helps
Yeah.
her anymore.
Yeah.
Yeah,
Yeah.
so there's still cases that cochlear implants in surgery is done on adult cases.
True. True. It's just I find that actually in especially I'm working in the government setting, so so mostly we are aiming for those who are in the children who are still in development. We want to catch them before because it will significantly affect their development, their speech especially. So we want to catch them to rehabilitate them early. So mostly the cochlear implant is reserved for those age group. Okay, but I agree there are cases I've seen cases that we perform in adults, and it markedly helps the patient actually. Mm.
Yeah. Okay. Okay. I think we have covered most our topic today, right, doctor?
Mm. Yeah, I feel that we have covered today topic, and I have achieved my objective to educate the public.
Yeah, we do learn a lot from you today, doctor. So can we take some time to look to our comment box so that
Mm.
doctor maybe have some time to answer their questions?
Sure,
Okay,
sure.
let's see. We have questions from Matt Wong. Hi, Dr. Hazim. What causes retracted eardrum? Will retracted eardrums cause hearing loss?
Uh, Okay, there are few retracted eardrum. It's a common term, or retracted tympanic membrane, as the medical term. There are few causes of a retracted eardrum. Uh, Number one, from my picture just now, I've shown that actually uh, the middle ear, the ear is actually connected through the nose. There's this one tube that connect with the nose, what we call a eustachian tube. Okay, this tube function to equilibrate the pressure between the middle ear and the ear and also the atmospheric environment. Sometimes a person have flu or frequent mucus production, for example, allergic rhinitis, they have a lot of mucus production, or chronic sinusitis, a lot of mucus production will impair the function of the eustachian tube. So when there's a negative pressure, the eardrum will be retracted inwards. Other than that, there are also other conditions, okay, like I call just now middle ear effusion, production of fluid in the ear, okay, which eventually will cause the ear to be retracted inwards. There are certain ear disease, ear infection, and special ear disease, what we call cholesteatoma. Some patient of them will also have a retracted eardrum. So all of these causes of ear are the causes of a retracted eardrum. And as the second part of the question, does a retracted eardrum have impact impact the hearing? Uh, if only actually the eardrum, if we learn the physiology, contribute just a few decibel. Yeah, if even if the whole eardrum is lost, there is only a minimum loss of hearing. Okay, so if only a retracted eardrum won't significantly cause a very bad hearing. But if it's paired with another disease, for example, just now I mentioned a middle ear effusion, okay, or otitis media, infection of the inner ear, that will significantly affect the hearing level. Okay.
Okay.
Mm.
And there is another question for Doctor
Mm.
from Joseph. What is the treatment for large eardrum perforations with recurrent ear discharge? Will you recommend patching of eardrum?
Okay. All right. Very thank you. A very good question. Okay. So, of course, the mainstay of perforated eardrum is surgery, whereby we will use we will patch in a simple way. We patch it up. We usually takes a layer of the skin, either usually is from here, from this side at the temporal region, or sometimes we take from this small area near the ear. We take the one of the layer of the skin and patch up the eardrum, the perforated eardrum. Okay,
Mhm.
it will be done in a operation theater. Okay, but the caveat of it, the prerequisite for this operation, usually what I and a lot of ENT surgeon once we want at least a 2 to 3 month for the ear to be dry, because if it's still discharging and we try to patch up, the patch won't stick. It will come out. The operation will fail most of the time. Usually we want it to be completely clear from discharge for at least 2 to 3 months. Okay, I do understand there are patient and there are condition whereby patient doesn't have for many years. They keep discharging. They won't achieve 2 to 3 months of completely dry. So in this kind of patient, we need to work out why is the patient still having discharging ear. Most of the time, we will arrange for a scan to see what is happening inside the middle ear, inside the temporal bone, what is happening. Okay, so if we have for example in this case, for if it's associated with other disease, for example cholesteatoma, like I mentioned just now, a special disease where so we need to clear up all the disease, make it dry, then we patch it up. Mm. All right.
Understand. And
Mm.
another question from the flow from Imtinan. If patients has narrow ear canal due to
Mm.
aging, is there any treatment? Does this cause hearing loss?
Okay. Yes. A narrow ear canal. Okay, it depends. Okay. What problem with narrow ear canal is not much of hearing loss. Not only hearing loss. They will have the tendency to have other problem. For example, they have higher chances to develop impacted earwax because it's very narrow. The ear canal will be very narrow, so they have a higher chances to develop impacted earwax. And then if they develop infection, the whole ear can become edematous, or can become the whole ear canal become closed, and subsequently we develop it will affect the hearing loss. Most of the time, a narrow ear canal is not a sole indication for surgery. It depends. If it's sometimes it's incidental, patient also doesn't realize they have perfect hearing. Suddenly, when we for whatever reason they come to see us or come to see the doctor, we say, oh, an incidental finding, they have a narrow ear canal. So in this kind of patient, we don't have to embark on any operation. But if it causes significant effect to the patient, for example, recurrent ear infection or uh, recurrent ear infection, so it is one of the reason to perform a widening ear canal, what we call a canaloplasty operation. Mm.
Mm, okay. Thank you for Doctor. I think there is no more questions from the floor.
Mm.
And now we have come to our ends of our today's sharing sessions. And much appreciated for Dr. Hazim to be
Yeah,
here for
yeah.
us today.
Mm.
And if anyone here has any questions or any doubts related to hearing,
Mm.
you are welcome to email Dr. Hazim or pay him a visit in Hospital Kuala Lumpur, which is in level 6, Complex Pakar dan Rawatan Harian.
Yeah.
Or you can find the email and address in the comment box below, which we have pinned it earlier. Or
Okay.
else you can contact us, Tiny DB Hearing, or drop by any of our outlets. Yeah, and please do like and follow us, our 20 DB Hearing page, Facebook page, and also can subscribe us in YouTube channel for more info in future. Actually, yeah.
Mm.
Thank you again, Doctor, for spending your Saturday with us.
Yep.
Any
Thank you.
last word to the
Okay.
audience?
So my last word is I hope the public, the audience, have gained some knowledge regarding this condition, hearing loss. It is preventable, and if it's not, if you're already suffering from it, or your loved one is suffering from it, there's a lot of way to test and treat it. So please come and seek professional help. Don't let until years and years for the problem to be ongoing and suffer it and cause significant suffering to you or your loved one. Right. That's all from me.
Yeah. Thank you,
Okay.
Doctor. And
You're
thank you,
welcome.
everyone who is watching. Have a
Mm.
nice Saturday and bye bye.
Bye. Mm. Bye.